Good afternoon and welcome. It's a great day to be here in the beautiful state of South Dakota. It's a Chamber of Commerce day from a weather perspective. I think every day in South Dakota is like this, right? Good. Okay, good. I'm glad to hear that. Well, I'll tell you, we are so glad that you are able to join us here today. And we are thrilled to have so many of you also joining us via Zoom as well. So welcome to all of our attendees. My name is Kevin Harker. I'm the Executive Vice President for the American Heart Association Midwest region. And I drove up here yesterday from Kansas City, and I spent went to a couple of meetings at hospitals. I went to a couple of meetings at schools. I went to a couple of meetings in corporations. And there's some amazing things that are happening in the great state of South Dakota. And so I want to congratulate you on that. I also want to say there's great opportunity here. Uh-oh. There's also a great opportunity here in the state of South Dakota, and we'll be able to talk a little bit about that as well. Before we begin, though, I want to focus on the profound impacts of stroke, and we want to take a moment to acknowledge the passing of Senator Tim Johnson. He was a man who contributed so much to the state in his decades of public service, and our thoughts and prayers are certainly with those who loved and respected him. Senator Johnson's passing brings the importance of this work to the forefront and makes today's announcement even more important. Well, I'm delighted to be here today to announce a gift of nearly $4.4 million from the Leona M. and Harry B. Helmsley Charitable Trust to strengthen the full spectrum of stroke care across the great state of South Dakota. Through the American Heart Association's Mission Lifeline program. The Helmsley Charitable Trust support has been foundational of improving rural health in the upper Midwest for more than a decade. And with today's announcement, the Helmsley Charitable Trust support for improving heart and brain health totals nearly $91 million in rural states. So congratulations and thank you for that very generous support. I mentioned earlier that I'm the executive vice president for the Heart Association, but one of the other titles that I'm proud of is that I'm also an STG. And you may not know what an STG is, but it's a small town guy. And so I'm really grateful for my Midwest rural upbringing. I grew up in a town of 800 people. We had a competition earlier about how small our graduating class was. I didn't win. We have somebody here that had 8 in their graduating class. I had 36 in my graduating class. But the closest hospital was a critical access hospital that was about 15 miles away. It had about 15 beds in it as well. And as a small town guy, I see the challenges that are facing rural communities in America. It is not lost on me that unfortunately, if you live in rural communities, your life expectancy is 3 years less than those individuals that live in metropolitan areas or in suburban areas. And that's not right. That's not okay. And what I'm really excited about is because of programs like Mission Lifeline Stroke and because of funding from organizations like the Helmsley Charitable Trust, we're able to not only identify the problem, but we're able to do something about it, right? And that's what really is so important. When you think about stroke, it's a time sensitive issue, and we want to make sure that when individuals able to identify a stroke through FAST, and that's what the acronym that we use to be able to identify it. Face, and maybe a drooping of the face, an arm, maybe one of my arms is not able to lift, maybe the speech is slurred. And so that's the FAS. And then T is time. It doesn't mean time to try to take a nap and sleep that off. It doesn't mean time to call a friend. It doesn't mean time to drive yourself to the hospital. It means time to call 911. Because when you're able to call 911, you activate what we call the chain of survival. And that chain of survival is so important in every step, from dialing 911 to accessing EMS, to going to the right hospital, to being able to make sure that we're getting the right care through something called TPA. And TPA is a clot busting drug. And that clot busting drug is able to help people survive and hopefully thrive after a stroke as well. And so that's why that chain of survival is so important. And that's why Mission Lifeline is also so very important. in this effort. And this will truly save lives and change lives throughout the great state of South Dakota. As I mentioned earlier, I want to talk a little bit about the Helmsley Charitable Trust because one of their trustees is here, and he's very humble they have made a tremendous impact, and they are national leaders in this effort. No other foundation has taken such a strong and generous stand for rural healthcare in this country like the Helmsley Charitable Trust. And so, including this gift today, through the support of the American Heart Association, it's been about $91 million. And then I'm going to let Walter be able to share the big number of the total support to rural communities. And so with that, Walter, thank you for being here. I want to introduce Walter Panzier. He's the trustee for the Leona M. and Harry B. Helmsley Charitable Trust. Walter, thank you.
Thank you so much. It's truly an exciting day for South Dakota. It's an exciting day for all residents here because healthcare equity is continuing to come across border to border from big cities to small town. A little bit about the Helmsley Charitable Trust. We've been in existence since 2008 and have given over $4.5 billion to a wide variety of range of healthcare improving healthcare outcomes across the world. Rural America is one of our key areas of support. Since that date, we have given $750 million to try to improve rural healthcare across America. And just in South Dakota alone, one of our original states in our rural healthcare portfolio, we have given over $141 million to a variety of causes, everything from improving cardiac care, now stroke care, access to specialty care, cancer care, improving EMS and other outcomes over here. So we are truly bought in to making rural America an equitable place to be, because I always say your zip code should not determine your healthcare outcomes. But unfortunately in America, your zip code does. And that's not right. Everybody should have access to the latest and greatest technologies and the latest and greatest healthcare. It doesn't matter if you're in a small little town like Belfouche, South Dakota, or the big city of Sioux Falls. Everybody deserves equal access. And the Helmsley Charitable Trust does do that with great partnerships with like the American Heart Association and also the state of South Dakota. We could not get this done without partnerships with the Department of Health and the state of South Dakota, because these are truly statewide initiatives. Just to give you an idea of some of the things we have done in the past here to improve cardiac outcomes and health outcomes in South Dakota, we have provided AEDs in every law enforcement agency across South Dakota. Another great partnership with the South Dakota Department of Health. So that way, if you're having a cardiac arrest or someone is having a cardiac arrest, it's so important that the law enforcement officers are always the first ones that arrive because they're out on patrol, unlike, volunteer ambulance services that are great for South Dakota and provide 85% or more of the EMS services in South Dakota. The law enforcement officer is the one who arrives first. And we all know that early defibrillation is a key to survival. So we've done things like that. We've done cardiac care, Lucas devices in the back of every EMS agency, automatic CPR machines that do automatic CPR, and we are seeing lives saved. So not to mention access to specialty care in rural areas. So neurologists can make a virtual entry into most hospitals across South Dakota and be able to see a patient virtually and determine whether TPA should be given out from the outset. So those are ways that we are trying to level the playing field here in South Dakota. Talking about this grant, this over $4 million grant, which is a total over about a $5 million initiative here. This is huge for South Dakota. Just to put it in perspective, it will not matter in the future whether you have a stroke in a small town or a stroke here in a metropolitan area. The system of care will be the same. border to border in South Dakota. And that's truly a game changer. Everybody's going to be doing the same thing. And it all starts with public awareness. You're going to see an increased public awareness campaign out here because it is so important for the public to know the symptoms of the stroke, to activate the 911 system. We're going to have increased training and increased awareness of our EMS people and dispatchers to alert the EMS people that this looks like a stroke, so they get there in time. And the EMS people to identify the potential stroke out in the field so they can notify the proper hospital and go to the stroke center hospitals that will be certified. It's key building the system of care because with all this coming together, you don't have higher survivor rates. And that means more South Dakotans recovering and living from the devastating effects of stroke. What I did not mention is something totally unique that is now coming to South Dakota as well. It's the post-acute care portion of the stroke. So what happens after you have the stroke? How do you go about, how do the families, individuals, loved ones choose what's best for themselves or the victims of stroke on rehab? So what this is going to do is set forth guidelines for post-acute care. So that way, the consumers, the people of South Dakota, can make educated choices of where to receive post-acute care and rehabilitation after the stroke. And that's going to be key because sometimes it's available in a small town where the person might live. Other times there'll be more, the consumer will be more informed and be able to make a decision and say, okay, we have to go a little further out to receive that care. It's going to be a great certification program for the facilities and awareness for the people. So I am just so incredibly excited about this partnership. This just means so much and will save so many South Dakotans and improve their lives. And hopefully we can help break the cycle of stroke and really return to healing of those who have had stroke and return them back into the workforce, back into the communities. So thank you so much.
Walter, thank you so much. We are so grateful personally for your leadership and your passion for this. You are making the Midwest and rural communities and South Dakota in particular a healthier and stronger place, and we are so grateful for that. This work cannot be done though in a vacuum, right? And so we need stakeholders to be able to support this work and to be able to work together. And so we are so proud to collaborate with the South Dakota Department of Health to ensure the best possible outcomes for stroke survivors. And so it's my honor to be able to introduce Secretary of Health, Melissa Magstad. She's the Secretary of Health for the South Dakota Department of Health to talk about how Mission Lifeline Stroke will impact South Dakota. Secretary Magstad?
Wonderful. You get the feeling something special, when you sort of a moment in time when you know it's the right moment and people and the place and all the pieces are in order, that you sort of have this moment that this is a very special time for South Dakota. And I would almost say use the word historic, that this is a trajectory changer on behalf of the state of South Dakota and its citizens. And I want to thank you. It is so obvious to me. And we were sitting talking out in the front hallway and, his history of emergency services, paramedic, and he's been living on the front line. He's lived it. He's taken care of those patients, and that connection of your passion for patients matched with rural healthcare and the generosity, we get to be the beneficiary of that. Boy, and that's quite a gift. On behalf of South Dakota, I want to thank you from the bottom of my heart. For myself, my kids, my grandkids, my Grammy, my aunts and uncles who all call South Dakota home, it means something to us. Thank you. So I can't thank you enough. And it's not even today's impact. The ripple effect of this impact is going to go and continue on past the time the rest of us are all here, because we're doing this on behalf of South Dakota and setting up a system of care that no matter where you decide to live, if it's in our metro areas, if you decide to live in our frontier areas, in places that have graduating classes less then 8. There are places. Even if you chose those places to live, that access to care should be yours. And I echo Walter's sentiment that it should not matter where you call home to your access of care. That should be a quality. If you are one of our ranchers out there, you should have that same access as our folks who choose our metro areas. And Kevin, thank you for the American Heart Association. You've been doing this for 30 some years, and we were having this conversation that 30 years ago, how much things have changed in heart care and cardiac care and stroke. Things have changed, but also the possibilities of how people can be intervened with right in the moment. And then that long-term care and that post-care, the potential for folks to live and have decreased mortality rates and live their best lives post-stroke is possible here. And to me, this is the time for us to get into this, right? This is absolutely the right time. These are the right people. These are the right moments in time. And we are all in on this. We were talking to Chrissy yesterday and talking about what an exciting day this is today. Wednesday is so exciting. But you know what's more exciting is Thursday when the work starts. That's the better day. And so tomorrow, when we start getting the shovels out and start digging the trenches and doing all the things that it takes to get this lifted up, that's really the better day. And I can't wait for Thursday to start. It's like, I always think the best time to plant a tree is 20 years ago, but the second best time to plant a tree is today. And so I am so excited to bring to South Dakota and support this. I've gotten to do this role for just 2 years, but I've gotten to practice in the state of South Dakota for 3 decades. And these are my family, and these are my friends, and these are my neighbors. And I care very deeply about the patients and their outcomes and their families and the individuals. I care that every South Dakotan lives their longest, fullest, healthiest, best life in my state. And I believe absolutely without a shadow of a doubt that the stroke care system is going to be key for those folks who need us in that moment to then get on with the business of living the best. So that's really truly my heart's passion. And I see the stroke care, sort of lining up with that same type of vision of providing that quality care across South Dakota. And I think, did you say border to border? Yep. And we're a big, big state. I think we're the 17th largest in the nation, but the 5th smallest population. We like to have room out here. We like a little wiggle room. We like to have a little space. Some of that brings the challenges of it, but I wouldn't have it any other way. But it does mean that the stroke system of care, as important it is in a metro area, it's even more critical in rural healthcare. And who chooses to live in our frontier and tribal nations will benefit this as well. And you know what? Sometimes it's just about timing. The right people, right place, right set of circumstances. And really, I think this is the right place. And South Dakota has actually been getting themselves ready for this project for the last few years. In 2017, we developed the Cardiovascular Collaborative Initiative. And that's a lot of words. But what it really means is these physicians and medical professionals and paramedics and agencies and organizations all committed to coming together and pooling their resources and expertise and volunteering their time and putting together skill sets and putting together a collaborative plan to really start impacting cardiovascular health in South Dakota in such a vast state. And they put a strategic plan together. We're in the midst of doing our strategic plan. And that plan has an education and prevention piece, but it also has investing in best practices in acute cardiovascular injury, that particular piece. And then it also has the supporting the disease management and that post-acute care. And supporting those who are survivors to have the best rehab possible to get back to that good living. And so I see this stroke initiative as a key piece in that. And we're all very aware, there's folks in this room, that time is of the essence when you're talking about stroke care. Trauma care, heart care, and stroke care. Every minute counts. And we think of time passing in days and hours and in years, but in stroke care, it's minutes. And there's a timer that starts from that first symptom all the way to that definitive care, and absolutely makes an impact on patients and their outcomes. And I see the stroke system of care as being that link and getting patients to understand, and you did a fantastic job of doing the FAST acronym. I want every South Dakotan to know what that means, right? Facial, arm, speech, time to call. And so that is a part of it. I want kids taught that. So right when they're with grandma, that, you know, kids are smart. They just suck it up and they just implement it right away. I want that to be a part of the normal conversation, that every South Dakotan is ready to intervene if those things were to happen. So I see this initiative having far-reaching impacts. The prevention side, making sure our EMS providers are also educated to recognize those symptoms early and quickly, and to activate, you did a really good job, activating that chain of care. That was really like itsy bitsy spider. Almost. Yeah, activating that chain has to be done early and quickly, but also has to be recognized by, isn't it? Itsy bitsy spider, yeah. Our EMS providers need to recognize it and know it and route those patients to the most appropriate facility as quickly as possible. Because again, time is of the essence. And then when they reach those hospitals, if it was critical access, and the first hospital they got to was a critical access hospital, or the first hospital they got to was our metro hospital, that there's a set of guidelines and best practice protocols that are instantly implemented and utilized, whether it's those clot busting medications or interventions or whatever that is. There are absolutely treatment protocols that now exist in healthcare that really can determine the outcomes of patients. And every one of our healthcare systems needs to be at the ready to implement that. Nobody ever plans to have a stroke, so you have to be ready all the time to implement that on behalf of our South Dakotans. And then lastly, and this is, I'm very excited about this, and Walter brought this up too, is that post-acute time. We've identified it, we got them into the right treatment, the hospitals did a fantastic job, but afterwards, that very intentional, purposeful post-acute care, so that that rehab journey and that recovery journey is the best it possibly can be to get back to that independent living. Personally, the best living that you could have in South Dakota. I have a little bias towards this state. And so what will a stroke, system of care do? What's like some of the nuances? What difference does that make? Well, a couple things that it adds. We're going to be equipping healthcare facilities and emergency services with those standard treatment guidelines. So if we train them to that level of best practices, even if you show up in whatever critical access hospital, they're trained at that same level. You don't have to worry about, am I going to a hospital that understands these principles? Oh no, they know it and they're implementing on your behalf. Will also help us create a framework for healthcare systems to become designated stroke systems, depending on their level of capability, right? Critical access is going to have a different level of capability than a tertiary center. However, and I would tell you, and my fellow emergency people know that what happens in that first period of time really sets the trajectory for what happens downstream. So it is critical that our frontline EMTs, EMS, critical access hospitals know how to do it and do it well. In addition, bringing that training and education and prevention programs all put together. And this is a piece that we're going to bring, is bringing a stroke registry. Now, and we kind of think, well, stroke registry, what difference does that make? That is the place where we're going to gather all of the data about what's happened in every one of these stroke events, and we put it in a repository. And we can then become analyzers of data. And when you're analyzers of data, you can find best practices and performance improvement metrics and all of those things that we can do better. And we can circle back and then do better with our EMS providers, train up a little bit more, address a little bit more, all for the final outcome of patients who live well and do well in the state of South Dakota, whether you're in critical access, whether you're clear out in Harding County or Pine Ridge or Mobridge, or whether you're in Sioux Falls. And so that registry doesn't just gather data for the sake of gathering data. I said, I don't want to ever gather data that we don't do something with. Otherwise, it's a waste of my time. But if we gather data, we put it to work for us, then all of a sudden it's changing outcomes, and it's changing lives, and ultimately saving lives. And saving not only lives, but saving quality of life lives, which is absolutely possible with the stroke system of care. And I appreciate the data-driven model of mission Lifeline. They think this way already. This program is already wired to look at data and validate that data and use it to make positive impacts in that system of care, which guides future investments and guides directions that we need to go. I look forward to seeing that data and see how we do and what we can do year after year to make stroke care better on behalf of our state. And I'm excited to see what this all possibly means for the state of South Dakota. I have no doubt in my mind that when we go back and we look at that data, we're going to look at this moment in time and say this was so monumental in the healthcare outcomes for the patients of South Dakota, that our grandmas and our sisters and our brothers and our uncles and our children are all going to be the beneficiaries of what happened at this particular moment today. So thank you for inviting me to come. And congratulations, South Dakota, on the gift that you just received. You got quite the gift. So.
Thank you. It was so great to be able to spend time with you today and be able to hear your story then too, but also be able to hear your passion for this work. So well, thank you so much. I loved how both Walter and Melissa talked about data. It's so important. I'm a firm believer that which gets measured gets done. And so that's what's going to save lives, is being able to make sure that we have those measurements in place to be able to accomplish great things with that. I want to shift gears a little bit though. Because at the Heart Association, the center of all that we do is the patient. Walter and Paul and I were talking earlier, and we talked about the individuals who are counting on us, who are counting on the American Heart Association. And that's the patients and their family members who are counting on us. And so I think it's important to hear from our survivors, those individuals who have been impacted by stroke. And so I'm really honored to be able to introduce to you Sean Lyons, to be able to share his story with us. Sean.
Good afternoon. Good afternoon. No, I have a tax in my right hand, so I'm not going to do the itsy bitsy.
Again, yes.
Thank you, Kevin, and thank you for all being here today. It's an honor to be here today to talk about a subject that holds deep meaning to me, both personally and professionally: stroke aftercare. For this, I am grateful. 7 years ago, at the age of 46, and in good health. Now, my wife would argue that I wasn't in good health. I experienced a life-changing event, a stroke. Since then, I've come to understand firsthand that recovery is not just a one-time event, it's a journey, one that continues long after the initial hospital stay. Let me provide some further background on the stroke event itself and a few life details. I've spent about 30 years in public affairs, working in both the private and public sectors. I said to Secretary Meg said, I don't know if I should call you secretary or representative. That's where I first met her. The art of speech and building relationships was the essence of what made me tick. I pride myself on hard work, determination, and learning issues. I was attending a conference in Portland, Oregon when my stroke occurred. As is the case with strokes, I had no warning of what was going to occur. From what I recall, I felt an excruciating headache, followed by a tingling sensation, and then numbness throughout my body. I eventually lost consciousness. I had fast acting, get like Kevin fast. Called to an ambulance. I was taken to a hospital neurological intensive care unit. Eventually, I was moved to a world-renowned neurological facility called the Rehabilitation Institute of Oregon. I owe a huge amount of debt to my medical providers and many specialists. My wife, Stephanie, flew across the country to be at my side throughout my care. Our two sons, Michael and Jonathan, ages 8 and 13 at the time, were back home being cared for by family and friends. I had to relearn basics like showering, other hygiene, and feeding myself. I also had to learn basic communication and skills of speech. I initially couldn't walk, and my mobility was very weak. Physical therapists used a ceiling harness and a walker to teach me how to be mobile again. After working vigorously with my various therapists for over a month, we were eventually able to come home. Traveling was no easy task. I'll spare some of the details, but it involved taxis, multiple flights, airport accommodations. It's kind of like I sit on planes, trains, and automobiles. Eventually, I settled into a normal back home. For over a year, I continued extensive rehabilitation and medical care. My rehabilitation back home included speech, physical, and occupational therapies at a local hospital. Therapies were 5 days a week and several hours daily. I was mentally and physically exhausted at the end of those days, but I was determined not to give up. In addition to my family and friends, I've been aided in my continued recovery by our dogs. I walked them regularly and even tried running with one of them. Now, it wasn't pretty, but I've been told it wasn't pretty before the stroke either. Canine members have provided me with unconditional love, and this has been exemplified throughout my continued recovery. As I mentioned previously, I could not walk for a lengthy period following my stroke, which occurred in September of that year. I was doing physical therapy. When I was doing it, I set a goal of November of that year to walk again. And by Thanksgiving, I was actually walking 2 weeks before that. So that to me was a personal goal, milestone. I recall awaiting one of my therapists thinking I could do whatever is thrown at me. When we talk about a stroke, we often focus on the immediate medical process, the emergency care, and the urgency of intervention. And while those moments are critical, what happens after a stroke is just as vital. Aftercare is where true recovery truly begins. I was encouraged to initiate a stroke survivors group and caregivers discussion for our immediate area. The mindset was that this would be an opportunity for those impacted by a stroke to hear on various topics or activities and just learning from one another. Aftercare is about rebuilding not just our bodies, but our lives, and in my case, those around me. In my own experience, the aftercare was not just about regaining physical abilities, it was physical recovery and rediscovering my purpose, both personally and professionally. Excuse me for a second. Like you get to hear me talk some more. My stroke didn't end my life in my late 40s. It changed it. I found new beginnings in places that I didn't expect. I realized that my journey could inspire others to persevere and reclaim their futures. Today, I do a monthly motivational video, as well as a daily thought posted to various social media platforms. These devotionals provide me with the mental processing and research skills. They also work on my speech and measurement thereof, and hopefully to motivate others. I continue to serve on various state and local boards trying to pay it forward. Following my various rehabilitation, I participated in a return to work program through our state Department of Labor and a local employer. I undertook various training. I worked with the Vocational Rehabilitation Office. I started a research firm and am currently employed in the public sector. It was extremely important to me to help provide for my family. Following my stroke, I started going to a men's group that meets weekly through my church. I tried to journal my thoughts on topics as well, and I still work on daily on various speech exercises. What helped me was having a network of people, my spouse, medical providers, family, and friends. who believed in my ability to recover. Their belief empowered me to push beyond my limitations, one step at a time. As someone who has spent years working to improve the lives of South Dakotans, stroke aftercare is a journey that is challenging, but also filled with opportunities for growth, healing, and renewal. The road to recovery is long, but comprehensive aftercare, it is possible not just to survive, but to thrive. Thank you for having me here today. Now I'm going to turn it back over to Kevin, and it is my sincere hope that the work will result in a system that works for many more people like me. Thank you.
Sean, thank you for being here and thank you for inspiring us all. And you didn't just survive, you thrived after your stroke. So thank you. And thank you also for your amazing work to get him through that. Caregivers are so important in this as well. I want to review some things fast. Okay, we talked a little bit about this, but face, arm, speech, and then time to call 911. And then what is this? It's not the itsy bitsy spider. It's the chain of survival. Okay, it is the chain of survival for stroke. Let me just wrap up by saying again another huge thanks to Sean for your amazing courage to be able to share your story with us today. I also want to thank Secretary Magstad for being here today and for your inspiration and passion for the important work that you're doing. And I also want to thank Walter and the entire Helmsley Charitable Trust team for your support, for your investment, $91 million to support the American Heart Association, but truly changing lives and saving lives. And so not only are we just talking about it, you're actually doing something about it. And we are so grateful for that. Our speakers are going to be here for about 30 minutes after this. And so if you'd like individual interviews, Chrissy Meyer is back in the back of, there she is, back in the back of the room. And so we can point her out then too, and she can have individual interviews for those with these folks. For the folks that are joining online today, you'll see information on your screen on upcoming webinars where you can learn more about Mission Lifeline Stroke in South Dakota. I want to thank you again for being here today, for your investment in the great state of South Dakota. For every 40 seconds, someone suffers a stroke. Those individuals are counting on us. They're counting on you. And I'm so glad that individuals and organizations like the Helmsley Charitable Trust are joining the American Heart Association in moving the needle on stroke care throughout the amazing state of South Dakota. We are excited to work to longer, healthier lives across the Mount Rushmore state. Thank you again for being here. Enjoy your day, and we stand adjourned.